All right, welcome back. This is the South African Morning. We're still on our theme, talking about the lack of trust that most South Africans have on the police. But lawlessness is becoming normalized in the country, and many blame this on a slow or even lack of response from the SAPS. Well, this is also true of gender-based violence. The Commission for Gender Equality has been looking into the issue. So let's now speak to the Commission's Dr. Nthabiseng Moleko about its findings. Dr. Moleko, thank you for your time and good morning to you. With just the data that you have, what does it say, particularly when we talk about police stations and their handling of GBV cases?
A very good morning to your listeners, and thank you so much this morning for having me. Well, I think the first thing is, if I can just give a background in terms of the sampling that we did and the basis for the study. CGE has done a report assessing the readiness and the implementation of the then emergency response action plan on the government departments. What we found was 17 out of 81 targets were met, and that would simply mean 17% had been achieved of those targets across the government departments. We then said, rather than complaining, let's rather look at what is happening on the ground in terms of service delivery nodes. Now, you already know that we are the best country when it comes to strategic plans. And so there is one for gender-based violence. SAPS also has a GBVF National Strategic Plan. So what we said is, let's rather look at some of the indicators across those 6 pillars that are in that plan and focus on those that deal with access to justice, support, care, for victims, and access to the justice system in terms of that. So we sampled 6% of the 1,155 stations. We did 66. We did 12 Tutuzela care centers because they're also a node in terms of service delivery and support for victims. And then we released the studies. It covers 8 provinces across the country. And we've looked at 43% of the GBV hotspots as well. We made sure that in that sample, we focus on those areas where there are serious problems. And our results and findings relate to that. So, Tumelo, if I can go to the findings in terms of some of the issues that we found. One, the plan and the National Strategic Plan in terms of SAPS, there's very little correlation and coordination between SAPS at the ground from the branch level to what National has reported. So there's a lot of course, targets there from the short term, medium term and long term. But we weren't able to see a link and a string between what's happening on the ground. So what we focused on was our monitor tool and look areas mentioned now. Really very high level of case withdrawal. We also found the quality of services at SAPS differs from station to station, primarily based we call the GBVF or VPF coordinator, and the level of this differs considerably from station to station, and there is no set minimum standard. Regard. We also looked at the victim-friendly rooms and the readiness. Remember, the point of reference and where service delivery happens is in this room. And we found that 40% of the rooms were not necessarily to the standard. That is according to their own empowerment standard. And we said that they must upgrade those. 60% were medium and high condition or good condition, but those 40% we said should be improved. And there's other findings across the pillars, but these are some of the few findings.
Yeah, and Doc, on the point on SAPS staff, the capacity of SAPS staff in dealing with GBV cases, what have you found there? Are they capacitated, to handle victims and survivors of GBV?
Exactly the point we made about training. So there's a pillar 3 in the National Strategic Plan that talks about training systems and protection. And this primarily comes from the competence. And we did find that the sample that we took across the board, between 19 to 80% of the staff were trained to differing levels. So we're talking about the variance across the staff. We did say, let's set a target and have 80% of the staff trained across the provinces, and that target should be a target that they meet. We also looked at the training that they have. Everyone talks about training. We said, let's look at the outcomes. Everyone is trained, but what kind of training? Is this training enabling, a reduction in what we call secondary victimization? Is this training enabling a more caring attitude? Is this training going to result in a more efficient personnel who is in front office? This is the type of training we're after. And I think there was a general recognition from the Office of the National Commissioner that what we must look at is the quality of the training and the outcomes of this training rather than simply talking generic training. And these are the issues that we said should be actually put on the table quite more, considerably so.
I mean, earlier on, I spoke to my colleague Heidi Jokers, who's in Orlando East right now, monitoring, police presence in communities. We're talking about preventative measures versus reactionary measures. And I just wonder, on the trains of sexual offences, what did you find there, just in terms of incidents of violence against women and children, and whether or not they're more preventative measures implemented or reactionary?
That's an excellent issue. I think that we have not sufficiently looked at as a country, generally speaking. So one of the pillars, when you look at the NSP, pillar 2 looks at prevention. And we specifically stated as the Commission that one of the things that we have not seen, and you must remember that SAPS gets its mandate from the Constitution. One of its mandates is to prevent crime. And I think that as a country, we're always responding after the fact. We're always looking at what has been done after. And I think that prevention strategies have not been employed sufficiently. What we did say was that we as the CGE are willing to help them in this regard in terms of specifically looking at our mandate, gender-based violence. Now, there's a lot of research that has been done in terms of prevention. And I think that the focus and the mode is on what happens post. And I'll talk to you a little bit about the statistics and the findings in that regard. But what we've seen is that in terms of prevention strategies, the Medical Research Council has done several literature review studies on what is happening on the ground. We don't need to repeat the research. We simply need to implement what they have said is necessary. Right. And what they have said is necessary is that we've got to look at post-traumatic stress disorder. We've got to look at non-violent responses in our people and in our community. We've got to look at ways to ensure that our people know how to deal with violent situations and reporting and creating awareness. And I think the whole psychosocial system in South Africa and the structure, we've got to have a mindset of no violence. And the trauma that we have as a people is primarily one of the issues. So I think generally across the nation, we have to. The second thing that you asked me is about the statistics around the violence. Now, we went to specifically 8 provinces using these monitoring tools. Not all the stations returned the tools. However, with the stations that we did find, what we found was there was a high prevalence of withdrawal of cases. What we found was that infrastructure does limit and accessibility does limit the likeliness of cases being finalized. Why? Because sometimes you find that cases are withdrawn and the distance and the cost, socioeconomic conditions have a massive bearing on our victims and their ability to access the system and the courts. We also had findings around Tutuzela care centers, if you would care to find and know those. But we made recommendations around social auxiliary workers being the minimum standards. We made recommendations about doctors at least being able to fill out that J80 immediately, and recommendations just around the modeling and M&E around those social development NGOs that are.
All right, Doc, we have to leave it due to time. Unfortunately, I would love to get into this in more detail, but we have to leave it due to time. Commission for Gender Equality, Acting Chairperson Dr. Nthabiseng Moleko, outlining it so very well for us in detail there. In that report, of course, you can find and just go through the research that has been found, just in terms of, the SAPS's capacity in handling GBV cases in this country. With that